Okay, so I want to be mindful of everyone who's joining us time and welcome you to this Proper Academy presentation, Defending the Defenseless, what every veterinary technician should know about their instrument reprocessing quality. And we are so fortunate to have Sarah B. Cruz with Pre-Treat CSS presenting today. Sarah is a certified CSPDT, CRCST, CHL, and Quality Education Program Development Coordinator for Central Sterile. As a CS Education Coordinator, she creates and institutes an educational programs for Central Sterile departments. This includes, but is not limited to, the formation of programs that relate to onboarding, developing competency, creating department culture, and so much more. She is also a Central Sterile program instructor at a local community college where she works with the future leaders of the CSS industry. Sarah always strives to develop CS industry professionals and best practices through writing and speaking. She's dedicated to the profession and continues to create as the president of Retreat CSS LLC, a platform used to educate, motivate, and help CS tech professionals onboard into career mindset. Through tangible action and physical indicators of success, we can kick the job mentality out of the department. Sarah uses her platform to highlight industry insights, conferences, and bring the industry to the front line. She vocalizes her passion through published articles, social media, mentorship, and public speaking. She is an industry expert and she is passionate about her message to put the CSS in success. So Sarah, thank you so much for being here with us today. Feel free to add anything if I missed anything about your background, and take it away with our presentation.
Thanks, Jamie. Hello, my patient professionals, and thank you for joining me today. What an introduction, Jamie. That was amazing. Needless to say, I'm Sarah B. Cruz of Pre-Treat CSS, and I am so excited to present Defending the Defenseless, a Proper Academy live webinar, continuing education. CSS Nerd is activated. I want to recognize everybody who's joining in today and really committing themselves to continuing education. Remember, our patients aren't the only thing that's living and breathing, so is our developing industry. So let's make sure that we're always making space to grow, develop, humble ourselves if we find that we're wrong along the way, and really engage so that we can always bring the best practices to our patients. I personally love the chat box feature, especially on Zoom, because when the meetings are running long, right? So anyways, please utilize your chat box feature. Tell me where you're checking in from. If you have any questions, there's also a Q&A feature. So you can enter questions directly there that I can refer to at the end of the discussion. I want to make sure everybody's feeling like they put the CSS in their success. So without further ado, welcome to Defending the Defenseless. When we think of sterile processing, patient safety is the first aspect that comes to mind. But reprocessing instruments isn't just limited to human healthcare. That's right, folks. Wherever there is a surgery, there is instrument reprocessing. And in that facility, a professional is working diligently to assure that their patient stays safe, even if they woof or meow. Animals remain some of our most significant loved ones. They're a member of our family, dare I say. They comfort us, they celebrate us, and if you're anything like me, you may even throw a birthday party for them when they come. Shout out to Walter, my 8-year-old corgi, right? Needless to say, our animal friends have a special place in our heart, and it's difficult to make those types of decisions regarding surgery, and especially to advocate for them when they can't advocate for themselves. It's especially more upsetting and disheartening when you, as a veterinary professional, commit your expertise to assuring an animal survives a life-threatening trauma or routine surgery, only to have them pass away from a post-operative infection. A lot of these post-operative infections can be prevented. We can't always control the reasons why these infections could happen, like pre-existing conditions or even comorbidities. The patient may have diabetes, they may have a multi-resistant staphylococci. There's lots of different reasons why infections happen, but they don't have to occur because our instruments were not properly cleaned and sterilized. And that's what today's presentation is focused on. We'll discuss some of the key components necessary to breaking the chain of infection and producing safe instrumentation through proper cleaning, disinfection, and sterilization practices. We'll commit ourselves to learn about instrument reprocessing best practices that are backed by validated checks and balances throughout the entire process. Our animal patients deserve our commitment to continuing education so that they can receive the best care. And you're already checked in today. So shout out to you showing up for your patient safety. Big respects and notifications. So there's a variety of ways in which veterinary technicians and assistants learn about instrument reprocessing, like continuing education videos, like the one you're watching today on Proper Academy. While there may be some review in their program curriculum, a lot of the actual skills and techniques are learned on the job. And the quality of the job training is dependent upon the current practices of the hiring clinic, quality of the provided training, and the proficiency level of the trainers on current standards and requirements. So a lot of the times when we begin training in our veterinary facility, you're learning hand-me-down or ways you've always done things, especially when readily available information about the sterile processing industry isn't available. These are consistent concerns throughout all of sterile processing. Similar to the human care facilities, lack of required credentials and ineffective on-the-job training programs can lead to patient safety issues. I can guarantee that there is always a concern with making sure we're staying up to date on our best practices. And this is in a space where we are primarily focused on industry updates and recommended practices, where we have a readily available access of a knowledge pipeline. And there's still concerns with making sure all that information is disseminated appropriately. When we're in veterinary facilities where that's not necessarily centralized to one individual, getting information like that can be difficult, to say the least, right? So how are veterinary facilities assuring that the on-the-job training provide a certain level of learning to their frontline veterinary technicians and assistants to perform at the high level of proficiency when they're cleaning, disinfecting, and sterilizing those instruments? Okay, I want to make one thing perfectly clear. See what I did there? Veterinary professionals do it all. I first learned about instrument reprocessing as a veterinary assistant. That's right. I started out in a small veterinary center that actually scaled to become a hub in my state's region. And I personally had the opportunity to work with an amazing neurosurgeon. That's right, a neurosurgeon. Craniotomies, laminectomies, cervical myelopathies. Oh, see, I remembered it. Cervical myelopathies on German Shepherds, pugs, and even cats, right? So I learned so much about myself and who I wanted to be professionally in this supportive role. I did the typical things like, walk, feed, and medicate the patients, but I was also responsible for assisting this awesome lead vet tech with MRI sedation and intubating the patient and recovering the patient, transferring them to the operating room table after they've been sedated. And keep in mind, these patients have compromised anatomies and premorbidities. I was also responsible for preparing the OR back table using aseptic technique and even turning over instrumentation for the next case. I was a vet assistant, and these were my responsibilities working on this service. Granted, these were not entry level and I had to work up until this point, but this on-the-job training that needed to happen was so essential and necessary to making sure that I executed patient safety, not just for the patient, but for the neurosurgeon that I assisted in this way. So when we say vet professionals do it all, they do. All right. They're the pharmacologist, they're the therapist to the patient and the pet, right? The patient and the owners. They're the radiographer, and they're even surgical nurses. And that's just a Tuesday. That's right. Our MRI heavy days were Tuesdays, big days, MRI, Tuesdays, and surgeries on Tuesdays as well. So, and that was just a typical day, on Monday through Friday. So most certifications and collegiate curriculum don't extensively cover or train the proper cleaning and sterilization of the surgical instruments post-surgery. I certainly learned on the job. While it is unfortunate because patients can become sick and even die due to the below standard reprocessing practices, mostly because of that training model we discussed in the previous slide. Okay, remember, we're learning hand-me-down techniques and critiques, and especially when veterinary professionals are pushed so much to work on the front end, that back end really does need a certain level of support. Even pulling it back to human medicine and sterile processing, we went through a process called centralization, which means that we took this practice and made it one area's responsibility for this, because when sterile processing was first created, it was everyone and their mom's responsibility. Okay, so it was either, and you know what that saying is, right? If it's everyone's responsibility, it's no one's responsibility. So when we're in a position to take on additional responsibilities that aren't primary focuses of our veterinary professional program, it can be overwhelming to a frontline job that is already overwhelming. I want to really highlight the point that veterinary professionals truly have the best intention for their patients. Truly. I've seen some amazing technicians and assistants put themselves on the line, mind, body, and heart to deliver for patients because they are someone's someone. A purr or a bark doesn't differentiate whether or not the meaning of the patient is ours to interpret. So I want to take a second to recognize all of our veterinary professionals that are joining us today. And I hope that this presentation will continue to support you in your abilities to offer safely reprocessed instrumentation and really defend the defenseless, which you do every day you clock in. But like I was mentioning, fewer higher educations offer these entities of the sterile processing education. When I became a sterile processing technician, I had to go to school for that, from transitioning from the veterinary practice to human healthcare. I didn't even know that was an option that existed. I literally thought the scope of reprocessing instrumentation was that what was in my facility. So whether or not one's department can achieve those goals really is based on luck. Okay, so let's take a closer look at why that occurs. Some of the issues that face veterinary practices when first diving into sterile processing in their facility includes initial cost. Products and equipment used in reprocessing can be significantly expensive, especially to smaller facilities, right? Even when I think back, those tabletop sterilizers, they're not cheap, and let alone the ability to check them and purchase the products necessary for them. So the availability of supplies like cleaning, your detergent, your enzymes, that is also at a cost. So you don't just stop when you buy the equipment, now you have to maintain the equipment, right? all the way down to our wrapping products. You know, when we've sterilized them, they must be wrapped in order to maintain that sterility. Everything has a price. So articulating the necessity of all these supplies can be difficult to upper level executives and decision makers, even in veterinary facilities. Time versus efficiency is, it's a sterile processing concern in general, right? So adding steps into a long existing process in order to meet quality and safety standards can appear to slow down current efficiency. So really helping individuals take a step back and challenge how they've always done things to see if their efficiency is creating the quality that they'd prefer, or is it just meeting the end goal of time? Efficiency is important. However, it's imperative to prioritize quality over efficiency and quantity sometimes. It's difficult to challenge the phrase, "This is how we've always done it," especially when you've always gotten the results you wanted. But were they always the best results? Right? It's a tough conversation, a courageous conversation indeed. Understanding. Articulating these points require understanding. So if you can't broach that courageous conversation with the key decision makers and your stakeholders, or even muster up the ability to articulate why the patients need this, it stops you right in your tracks. Educating and convincing veterinary clinic managers and these financial stakeholders on equipment requests, supply inventory, quality, and efficiency is challenging to say the least. Motivating volunteer attendance to veterinary professionals that aren't required to attend in services like the one you're attending today is even more difficult. Because if the professional is intrinsically motivated to propel themselves and learn the continuing education necessary, because extrinsically they're not motivated by their facility to seek additional knowledge, it's just the perfect storm for making sure that things stay the way they've always been and achieving certain results consistently, even if they're not the best for the patient. So higher education and standards and the accessibility to the sterile processing education is always a challenge. And I really do want to commend you all for bridging that gap and joining it in today. Okay, I'm not going to lie, this is probably one of my favorite slides in the presentation because we're going to go over some key terms in instrument cleaning. And a lot of them, I think a lot of people think that it is synonymous with one another. So let's challenge that today. I love a good challenge the way we've always done it, right? So now that the foundation is set and in place, let's discuss these terms. Dosing. In order to properly clean instruments, an enzyme fluid used to break down bioburden in blood on dirty instrument must be applied. So bioburden is a piece of biological material that literally causes a burden in the reprocessing practice. It's gross. It's literally a piece of somebody left behind, you know, little piece of fluffy just hanging out. And that's not okay. So we have to make sure that we're using the appropriate enzymes to help break down these proteins and fats. And what type of protein or fat you want to break down also helps you determine the type of enzyme that's used so they can be more efficient. All of this is done to prevent the hardening of the bioburden on instruments, while the detergents are used to lift the remaining bioburden off. So enzymatics or pre-treating the instrumentation is absolutely vital so that the dosing amounts of our detergents can work effectively. Detergents and enzymes are specifically formulated to work at certain doses and temperatures. So we have to make sure that we follow the IFUs provided by the company. Thermometers at the sink, maybe not necessarily going by touch, or, oh, well, it's steaming, so it must be hot enough. Specific temperature range has to be adhered to, because if you're using a certain enzymatic that requires a temperature and it's too high, you could be breaking down that product. So even though you're using it, you're not really using it. So too hot or too cold, no good, yeah? And now reaching the minimum effective concentration of a high-level disinfectants can leave an instrument contaminated with harmful bacteria, right? So now that you're actually cleaning the instrumentation, you got the temperature just right, but if you have too much water in your sink and not enough of the detergent, you have not reached that high-level disinfectant necessary and outlined in that minimum effective concentration to do what you think you're doing. All the best intentions, just with little cracks in between that really help hinder us in our ability to break the chain of infection. I like to think of dosing like treating for pain, which I think resonates a lot with our veterinary professionals today. Too little can cause the patient to still be in pain, right? And then too much of this medicine can cause significant harm and health issues. It's just like that with detergents. Too much, you don't want to encapsulate all of the debris left behind on the instrumentation. Too little, well, you're not really going to meet that effectiveness that you're hoping for, yeah? Important thing that I like to point out is that if it's not clean, it isn't sterile. Okay, so notice how clean and disinfection are listed separately. Throw in the word sterile in there. These terms are not synonymous. They do not mean the same thing. They are not interchangeable. Clean is different from disinfected, which is different from sterile, right? I know we're doing a lot of things today. It's going to be great. So when we look at our ability to clean, it's removing the blood and bioburden, which is a critical step for the success of sterilization to occur. Even if you sterilize an instrument and it has a piece of bioburden left behind, it's still compromised. If that bioburden goes into a patient, it can cause an infection or a surgical site infection, an SSI. So manual cleaning actually removes this instrumentation. And when we think of manual cleaning, a lot of us limit that thought to that physical motion of using a brush, right? Manual. It also includes automated cleaning with our machines like ultrasonics. I know in some facilities there's little tabletop ultrasonics and they make that really high-pitched noise. So cavitation is a phenomenal form of cleaning that we can utilize. Now, disinfection actually inactivates viruses and kills bacteria remaining on the surgical instrument. So we have to appropriately clean our instrument before it can be disinfected. The only thing that doesn't occur in disinfection is the removal of bacterial spores. Those can only be killed through sterilization, which is the void of all microbial life. Blah, blah, blah. Yeah, CSS nerd activated. It's going to be good. So, like I said, sterilization is the destruction of all microbial life. Veterinary professionals can be more confident by understanding how the sterilizer works to kill microorganisms, right? So when we use a variety of process challenge devices to test the functionality of a sterilizer, all of these process challenge devices that I'm about to go over with you are literally just made to continue to prove that we are applying ourselves and using appropriate practices to achieve sterility, right? There are nice little physical backup, yeah? So this can be a form of a difficult package that's difficult to penetrate, or a chemical indicator inside of the tray that has to reach a certain temperature or the sterilant to touch it for a specific amount of time. Yeah. So even making sure that when you open your instrument tray, you can see that the sterilant has reached through this type of indicator, which is a type 5 indicator. Yeah. So we use, remember how I mentioned the disinfection inactivates viruses and bacteria, but not spores? So we have a process challenge device called the Biological Challenge Pack that challenges the sterilizer to prove that it can kill spores. So inside of this biological challenge pack is a spore called Geobacillus stereothermophilus. I know, right? That's a good one. We don't ever have to say that again. Okay. Geobacillus stereothermophilus. And the reason why we use that inside of our challenge packs is because it is one of these difficult bacterial spores. So when we are putting it inside of our sterilizer and our sterilizer is working so efficiently that it can even kill this type of spore that's known for being able to really lower its metabolism, almost go into spore hibernation, dehydrate itself to the point where it's almost dead, and then still come back to life, our sterilizer is doing what it needs to do, and we are proving that. It's also important to point out that Geobacillus stereothermophilus is a highly resistant to heat. So again, making sure that our steam sterilizers are lethal enough to destroy it can help us assure our sterilization practices. To further prove that our sterilizers are lethal enough to destroy microbial life, we can utilize the sterilizer's receipt to verify and validate the correct cycle. There are more ways to help indicate that steam has penetrated the prepared instrumentation, such as chemical indicator strips and even the type of tape that we put outside of our tray. Chemical indicator strips provide the assurance that the sterility has penetrated the inside of the pack, whereas our external indicators like tape will literally change color, saying that the sterilant has contacted the outside of the pack. Depending on the type of sterilizer that is utilized, such as ethylene oxide, vaporized hydrogen peroxide, there's different types of materials used to react to the sterilants. I think it's important that we pause here for a second. Mistakes can be made. They happen. We are human, right? Our patients may not be, but we certainly are, yeah? So to provide barriers to error, there are products that are specifically designed for sterile processing. Like some of the indicators that I stated previously, there are more visual references that help us determine if sterilization has even occurred. So for example, like the tape that I had mentioned, before it even changes a color, that can raise an alarm to an OR team, checking that it's been sterilized. If they pick up a pack and see that there are no present black lines, for example, they're less apt to open that set because they can tell that it probably hasn't been sterilized. There's even little dots on rigid containers that go from white to black, depending on the product, but that's typically the color transition, that go white to black to show that there has been some type of external sterilant contact. There's also different shapes on the sterilization pouches. So as we utilize peel pouches, there's external indicators on the pouches themselves saying, yes, steam has touched this part of our pouch. Because it's all good and well when we have the chemical indicator strips inside the set, but utilizing normal tape, oh man, and not being able to tell something hasn't been sterilized until it's open and now it's probably already on your sterile field. It can be devastating. It can cause an entire case to turn over. And when we look at the veterinary clinic, you know that PAR levels are just right. There's not an excessive amount of products available to facilitate an entire turnover. That patient may have to be woken up. Surgery may have to be delayed. And anesthesia itself can be difficult for patients to deal with, especially our brachycardic, our brachioesophagus patients like pugs. Yeah, and they have that nice elongated soft palate, and it's difficult enough to intubate them, right? Poor little brachies, and they can't breathe and they're all snorty, right? Now we have to wake them up because we didn't have the products available to facilitate an entire back table turnover. So physical indicators really help with barriers to error. Cleaning instruments after surgery can be a dirty and hazardous job. Our ability to serve our patients rely heavily on our ability to protect ourselves. That's right, you have to protect yourself. Even though there's not a lot of common human to animal transmission, there are animal to human transmission when we talk about diseases, right? So for example, not saying, for example, like rabies, okay? So rabies can be passed from a animal to a human. This is heavily regulated. Rabies vaccinations heavily regulated by the government because of this, right? Now, the government can't necessarily come in and heavily regulate all the different types of animal diseases that can be passed to humans in this way, which, depending on where you stand, could be a good thing. Yeah. But you have to take that personal responsibility and then even make sure that other people respect that in your space. Okay. Making sure that you have the ability to wear appropriate, proper personal protective equipment or PPE is imperative to protect yourself from harm due to the contact with the blood and the bodily fluids. Okay. Splash guards, face masks, bouffant, an apron, a gown, gloves. These are important because it's not like a splash of something that's contaminated doesn't have the chance of going into a conjunctiva, or maybe you have an open cut on your arm or your hand unbeknownst to you that can be an entry point for disease. And really, if you're not taking care of yourself, you can't give from an empty cup. You have to take care of yourself in this manner so that you can continue to show up for the patients that need you to advocate for them. So using PPE and of course, proper hand washing also prevents the spread of bacteria and viruses to other coworkers, patients, and your family. If you're going into, so if you're a veterinary assistant, remember all the different routines I had gone through? Well, if I had done instrument reprocessing, and listen, I had done a lot because let me tell you, a number one upbite pituitary rongeur was one of the preferred instruments. So I was always reprocessing that one. And we only had like one or two. Okay. So I was always reprocessing that one. If I was reprocessing this instrument and then I went to go do my care rounds on the postoperative patients, I can get them sick by touching them. Simply washing your hands and wearing PPE will help lower the ability to transfer bacteria to your patients or other compromising situations. Because remember, it's a surgical site infection, even if it doesn't happen in the OR, okay? Surgical site infections are linked to an infection that the patient, nosocomials or a hospital-acquired infection are linked to infections that the patient leaves the facility with. That's not just at the surgical site, okay? That's also urinary tract infections. It can be an infection from a nail that got clipped too short while they were under sedation. So remember, nosocomials or hospital-acquired infections also affect our patients in the veterinary setting. So now that we've laid down the foundation, we understand why we have to take care of ourselves. We understand what type of different sterile barriers we can provide. I want to go even deeper into what some of those different areas ensue. I really want to offer you that type of education, and Proper Academy really wants to offer you the supplemental knowledge that may not be readily available to you based on updated standards and practices in the sterile processing industry. So verifying our processes is very important to create a safe patient outcome. We may be so focused on doing every step right, only to allow our machines to fall under the radar. That's right. So we have to make sure that our machines that we're using in physical or manual cleaning and in our thermal disinfection are working up to par too. It's seriously so discouraging when you finally do all the hard work behind it only for a sterilizer to fail. And then you have to rewrap everything, right? And I know we only have those little tabletop sterilizers in most veterinary clinics, so loading them and unloading it can be quite the task. Yeah. So assuming a machine is working as intended without verifying its function can leave instruments improperly clean. For example, when ultrasonic cavitation stops working, it's not easy to hear an audible difference. Even if you're hanging out in the sterile processing department of your veterinary clinic every single day, sometimes when things are broken, they don't make a noise, they don't smoke, it's not like they explode, right? So how do we make sure that our machines, such as our ultrasonic cleaners, are working the way that we need? So we can actually verify that proper cavitation, time, and temperature is occurring in our ultrasonic machines. We can do this with new process challenge devices, right? So we can use the testing supplies that mimic Bioburden. So you'll get little vials, or you can get different slides that have mock Bioburden on them and run them in your ultrasonic cleaner to see if it's removing all the Bioburden debris. Ultrasonic tests that contain these soil marks need to be completely removed in order to prove that the ultrasonic is working in the way that it should, in the way that you need it to, in the way that your patients need it to. Next, we'll discuss the impact of external indicators. Wrapping trays with any standard cape can be detrimental for two reasons. Like we had talked about in that simulated OR, we have the doctor, they're ready to open up their set, and all of a sudden they stop because they don't see the black lines on the tape. This is a big indicator. These physical external process indicators have literally saved lives, okay? And not to mention resources and maybe a little bit of our mental stability, right? So it's important to make sure that we're using tape that offers this external process indicator. Not to mention, if you're using a tape that isn't verified by an IFU for high heat steam sterilization, for example, it may not hold up. These autoclaves can get hot. So in the human facility, the standard load can be up to 270 degrees Fahrenheit, even hotter if necessary. So if we're using a type of tape that can't really stand up to the heat, it's got to get out of the sterilizer kitchen, right? These tapes come in a variety of, these tapes are made up of these tapes come in a variety of options depending on the type of sterilization that you're utilizing. So steam sterilizer tape isn't necessarily compatible for ethylene oxide sterilization, whereas ethylene oxide is a chemical reaction because that's the type of sterilant that's being used, whereas steam sterilization is steam is your sterilant. So steam isn't going to be present in ethylene oxide, so your tape won't change. And vice versa, if you use ethylene oxide tape inside of your steam sterilizer, that's not going to change either. So these can also be big indicators that the appropriate sterilization has gone underway. Internal process indicators give the sterile field that last little bit of ease, right? It's that big when you open up a sterile set. So as you open up your sterile surgical tray, how can you actually be sure that your sterilant has reached the inside of the package? How can you be sure? Your tape has changed, that's great and everything, but you don't want to leave it to guessing. So we use internal process indicators to show that the sterilant has reached. So these type 5 typically type 5, type 4s, type 6s can actually be inside of these trays and change physically to demonstrate if they have passed or failed. Some go past a line, clearing the window saying pass. Others require the bar to be completely filled. All of this can be outlined in the product's IFU. That's right, folks. IFUs aren't limited to just our instruments. They're used on our machines. They are used on our process challenge devices, and they are used even down to our detergent. IFUs reign supreme, okay? And they are updated pretty consistently. So making sure that you're aware of updates in an IFU is just one way to challenge the way you've always done things inside of your veterinary facility. But it's a really great feeling when the veterinary technician or the assistant or sometimes the resident is opening sterile trays and you're handing it off to the doctor and you see that, and it's just that nice little reassurance that yes, I've done everything necessary and the sterilant has actually met every part of this instrument you are going to use on our patient. Because don't forget, the doctor is doing the procedure, but they're your patient too. So everybody's involved in this patient safety, breaking the chain of infection. It's imperative. Biological indicators, as we went over previously, are really impactful scientific evolution. I just think they're so cool that you have this modified live little vial filled with a type of spore dependent upon the type of sterilizer that you're using, that you can challenge to prove, physically quantify or qualify that your sterilizer is working and that it is so lethal that even this spore can't handle it. I just think that's the neatest little piece of technology, scientific technology that fits in a challenge pack, probably about this big. And then in some of our sterilizers, we're making our own challenge packs, right? So like with ethylene oxide, we're putting the control inside of the pouch and we're sealing it. We're making sure we're wearing our stoichiometry, right? Stoichiometry badge in between our airways, our nose, right? And making sure that we're measuring our ppms, okay? So, but biologicals provide a live, hard to kill microorganisms, which test this lethality in real time and give us a physical way to prove that our sterilizers are working. When we incubate a control and we have something to compare the microbial presentation after sterilization, that's where the money is, right? So when we create a control, we're actually incubating a not sterilized vial. So technically speaking, in our incubator, we're creating the perfect environment for this spore to survive, right? It's nice and dark. It's all warm. Maybe it's a little moist in there, you know, spores, they love moisture, right? So when we look at our vial after it's been controlled, it should present yellow because we've cracked the vial, we've introduced the spore into the chemical agent that it needs, and it's going to eat, it's going to turn yellow. Okay. Now, after we've sterilized a biological challenge pack and we open it, we crack that vial, we incubate it inside of its nice, perfect try to create that nice homeostasis. It's purple. Well, that's because there was no spore to react with the chemical agent being released. There was nothing to eat, anything going on in there. So that's just another way that we can use biological indicators to prove the lethality of our sterilizers. It's important to ask ourselves, how clean is clean? Bioburden that contains microorganisms with the potential to cause infection and or kill are not always visible to the naked eye. I mean, they're called microorganisms for a reason. Micro meaning you need like a microscope to look at it. So even though we can use physical indicators of visual debris, like bioburden, literally physical chunks, you know, ultrasonic cleaning and the cavitation process help to remove those hard to see or those areas that you couldn't really get with your brush and you're trying to get it like where the lock box is, where the two instruments open, that indent there. Oh, or even again, the pituitary rongeur, you know how that little cup opens up, there's always bone there, right? In that little hinge, in that little spot right there. So making sure that real-time cleaning verification is happening, not just with our eyes, but with physical proof in our monitoring devices. So as we went over with our ultrasonic cleaner, we can also demonstrate that cleaning can be verified through protein testing. Okay, so again, we're going to take this modified bioburden, right? It's this protein this modified protein that looks and acts just like the real deal. And we send it through the cleaning process like our normal instrumentation, and it shows they're clean, they're removed, really proving that our cleaning process is working, not just hoping. Because remember, hope is not a strategy. Okay, we can't just hope that our instruments are clean. We need to be able to prove that the process that we're carrying out is reaching the end results, not because that's how we've always done it, but because we have proof of that. So remember what I said earlier, if it's not clean, it's not sterile. Bioburden left on an instrument creates a barrier preventing the sterilant from contacting the instrument surface. which is required for proper sterilization. Remember, sterile means the removal of all microbial life, right? So back up your process with protein testing that provides the instant cleaning verification results is essential in proving that what you're doing is really making the impact that you want it to have on your patient. Speaking of sterilization, have you ever stopped and wondered how the sterilizer actually functions? It's a pretty impressive piece of equipment. Depending on the type of sterilizer that you're discussing, there is so much happening once that door shuts. It doesn't matter if it's a tabletop or a wall unit, they are putting in work to make sure that microbial life is not present. So some of the types of sterilization is obviously steam, which we talked extensively about today in a lot of our references. So let's move into low temperature sterilization, which is pretty popular inside of the veterinary clinics, right? So low temperature sterilizations use chemicals such as ethylene oxide and vaporized hydrogen peroxide to sterilize surgical instrumentation. So don't forget to use the previously mentioned internal, external, and biological indicators to ensure that the proper functioning and lethality of the sterilant is being achieved. In these types of sterilizers, water is a big no-go. Because this is a type of chemical sterilant, when you're introducing water, which is chemical makeup, right, H2O, okay, so you have the introduction of the chemical in these types of sterilizers mixing with the present H2O, which shouldn't have been there in the first place. It's going to abort the load. It's going to make the load fail because now you have a new chemical makeup. So science, chemistry happened on in there to make sure, not just steam, but also with our chemical sterilizers. Speaking of steam sterilizers use pre-vacuum to remove air from the chamber before the steam can be injected inside. Sit with that statement. These little tabletop sterilizers are literally using pre-vacuum to remove air, void of air, so that when this saturated steam goes inside and starts to penetrate, there's no air present, because steam and air, they don't really mix. And I know that's like, Sarah, but isn't like air part of steam? No, this steam is saturated, coming directly from the heat source, really wet steam coming in so it can penetrate. So if there's air present, just like how our Bioburden can make a barrier on the instrument so the sterilant can't protect, the air does it the same way. So the air will sit and encase these little pockets and the steam just can't penetrate. It just kind of starts to bounce around it and it never really touches that access point. So making sure that our sterilizers function the way that they should, not introducing water to them, making sure that dynamic air removal is occurring, we can make sure that all of that's not happening with verification testing or validation testing, right? So we can use different types of dynamic air removal testing like Bowie-Dick challenge packs, right? This goes to show when we use a Bowie-Dick challenge pack, this will show that the air is being removed because it causes a pattern to appear on the challenge pack when that's achieved. Again, another physical indicator of proof that our sterilizers are working the way that they need to remove microbial life. Just like in all realms of healthcare, we are committed to be lifelong learners. Medical advancement and treatment techniques are constantly changing, and we must adapt and learn along with them. We have to seek learning opportunities, whether it's continuing education or higher education. This commitment and achievement will set you apart from others, both in proficiency and marketability. Our animal friends lack the ability to question their treatment. They might not like their treatment, right? We've all seen a dog adverse to a rabies vaccine before, haven't we? Or the dog that pulls away when they don't want the heartworm test. Okay, they do the little arm jimmy. So patients have very strong feelings about their care, but they can't speak and articulate what they need. So being a patient advocate is more than just speaking for them. It's actually performing the job correctly every time to ensure the utmost safety and quality for the outcome of the treatment. It's that real challenge of morals and ethics, right? If a tree falls in the woods and anybody hear it, well, we don't ever have to worry about that with veterinary professionals, because we know that given the appropriate tools and the ability, you will make the best decisions for your patients every time. So you're not the first to learn about the lack of proper cleaning and sterilization, or the access of knowledge that's limited in a lot of our veterinary settings. And you probably won't be the last. I personally didn't experience it until I actually went to sterile processing school and learned about it. Carry on the tradition of high standards by teaching others in your profession about proper cleaning and the sterilizing standards that you've learned about today and sought out on your own. Work with your supervisors, your clinical managers, and physicians by educating through education about correct equipment and supplies necessary to perform the cleaning and sterilization safely. It's important to develop processes and procedures that will ensure that change is integrated and followed consistently. Don't be scared. Change takes courageous conversation, and you are courageous for your patients. It's important for all members of the team to perform the process to the same standards. So pull everyone in to support you in this effort. Break the chain of infection and put a stop when there's a problem concerning the patient safety process. So after everything is said and done, play and repeat this part. What can we do? Educate ourselves. Know the latest recommendations and guidelines regarding instrument reprocessing. Mentor others through in-depth on-the-job training programs based on recommended practices and standards. Develop process and procedures to make sure nothing gets missed and to ensure safety and quality every time. On behalf of Proper Academy, we'd like to thank you all for dedicating your professional practice to the safety of your patients. Being an active part of breaking the chain of infection takes dedication, perseverance, continuing education, and a little bit of oomph, right? Speaking and defending the defenseless is a courageous part on your part, and making sure that we build that into your regular practices with all the hats you wear already really raises the integrity of veterinary professionals, and they should receive the accolades that they so have deserved. Thank you all again for attending Proper Academy's Defending the Defenseless. And I want to make sure I leave room for any questions that may be happening today.
Sarah, thank you so much for that presentation. We're so lucky to have you here with all your knowledge from pre-treat, CSS. We do have a couple of questions that I'd love if we have a few moments left today. So the first one is, what are some similarities and differences between animal and human sterile processing practices?
So the similarities is a lot of patient safety focus. And I know I opened with that, but it's important to recognize that patients are patients. It doesn't matter what they look like. It doesn't matter how we feel about them. I personally am not a fan of anything that has scales, but I'm going to show up and work diligently. And I have in that veterinary study to make sure that the patient received everything that they needed. I see a lot of differences between human and animal medicine in the interpretation of standards and regulations, specifically in states that require certification in the sterile processing space. So interpreting and having guidelines, policies, recommended practices by the AORN and AAMI, like the AAMI ST79, and even looking into AST recommendations like the surgical text. That wasn't something that was necessary, that isn't necessarily present or readily available in veterinary facilities. So I think that even though there isn't necessarily a requirement for veterinary professionals to achieve certification in sterile processing, I would like to encourage them to seek these resources, because it's not like anything we talked about today I just magically pulled out. Okay, I'm really not that clever. They're cited, they're encouraged, and they're regulated, or they're recommended through bodies such as AORN and AAMI that are, heavily considered for regulatory bodies and surveys and DPH, the Department of Health, and even other spaces. So these recommendations can turn into regulations. So having them on site so they can be referenced, I feel like would be the best benefit.
Awesome, Sarah. And I think that really gets at our next question. So this attendee is saying that they don't see a lot of content like this for veterinary technicians. They understand that there are things for them to learn. And obviously you've had a big transition from animal to human healthcare. I'm kind of adding to this question a little bit. You just mentioned several different organizations, AAMI, all these different organizations. What resources are available, whether it is those organizations or just other resources aside from Proper Academy, that someone can learn more either from you or just about how to best help their patients, and to even know if their sterilization practice is acceptable or not, if they're starting to see that maybe they're not following everything you talked about in this presentation?
Yeah, sure. So taking a big step back, that ability to integrity check themselves, the individual check, asking the question, kudos. That's what's up, because that's the type of challenges that it's going to take to the way you've always done things. And it can be very humbling to say, wow, I have not done that. And not only say it, but actually say it to an individual and share it for the presentation. So let's just take a moment to recognize that professional integrity right there. I want to encourage veterinary professionals that are interested in developing a more standard practice in their space to follow professionals in the sterile processing space. I know it seems silly and very, anyways, follow the hashtag sterile processing on all of your social media. Now, I'm not saying that anything you see on social media should be taken forthright, right? But a lot of that space is sterile processing professionals challenging the way we've always done it, such as, Rick Schultz creates an amazing resource for veterinary instrumentation. There's also Beyond Clean that kicks out amazing content about the up and coming standard regulations. Following organizations such as the HSPA, formerly known as ISHM, and the CBSPD, is also like following and checking in on different organizations that I had previously mentioned, like AAMI, AAMI, right? AORN, even the CDC, even if you're a little frustrated with them right now. So following just these on social media will help you gain the interaction with industry professionals in that space, which may have the same question as you. There are professional agencies working to create curriculum like this for veterinary medicine, such as Proper Academy. I know Anderson Sterilizers works diligently to create a vet tech tip where they talk specifically about reprocessing tips. So you're right. If you're frustrated because you can't find this content, it's because it's being made. They hear you. They want to help. So if you have suggestion or advice, don't hesitate to reach out to these companies and say, hey, I was a tech and I never had this before. Can you please help me? And I know there's a lot of sterile processing professionals in the space right now that have transitioned from veterinary medicine. I see a couple of them in the chat right here. What's up? So really advocating for that type of patient safety is also a responsibility of previous vet professionals, because we are aware of that and really garnishing that traction. But don't get discouraged, okay? It's coming, seek the knowledge, and unfortunately, you might have to think a little abstractly, but that doesn't mean we can't speak the same language, because standard practice is standard practice across the board, okay? A detergent doesn't need a different concentration level just because it's being used on a cat. So we can speak that same language, which can be disseminated to our separate patients.
Amazing. Well, Sarah, again, thank you so much for your time. Thank you to everyone who's joined us. A few people did come in a little bit late. This recording will be available at properacademy.com in the next week or so. We just want to edit it up, make sure all the audio is good. And with that, our contact information is on the screen here. If you ever have any questions, you can also reach out just to academy@propermfg.com. And I am certain that Sarah is also always available to answer any questions. Do you want to share the best way that they can find you and ask you any questions directly in the meantime?
Sure. You can reach out to me on pretreatcss.com. I'm also available on all social media at pretreatcss.
Fantastic. I'll drop that in the chat for everybody as well. And we greatly appreciate your time here. We'll send out a follow-up email. You'll get your credits by going back to properacademy.com. And we look forward to learning and educating you in the future. Thank you.
Thanks, everybody. This was fun. Bye.